Spectrum of neonatal sepsis. Types of neonatal sepsis. There are two types, generalized and localized. Generalized is called septicemia and localized is for specific organ symptoms. For example, pneumonia, meningitis, osteomyelitis, arthritis. And also there is an early onset sepsis or a late onset sepsis. So if it's within 72 hours of life, that is your 3 days, then it is early onset, otherwise it is late onset. And for early onset the infection is coming from the mother, and for late onset the infection is coming from the hospital. What are the risk factors of infection coming from the mother? First is chorioamnionitis. Chorio and your amnion is inflamed. Then there is an infection in the maternal genitalia. You can see foul smelling liquor in this case. And there is a rupture of membranes which is more than 372 hours. If the membranes are ruptured over 72 hours, then also. And what kind of infection is this? Pneumonia is more common than sepsis. While in late onset, it is coming due to unclean hands of the health professionals or caregivers, or due to low birth weight and hence low immunity, lack of breastfeeding. And then here you can see equal incidences, like it could be sepsis, it could be pneumonia, it could be meningitis. Etiology of clinical features and clinical organisms implicated. So India, the most common cause of sepsis in newborn is Klebsiella, most common Klebsiella. Second is Acinetobacter. Third is Staph aureus. And worldwide, first most common is GBS, that is group B Streptococcus, followed by E. coli and then followed by Listeria. So none of the three is matching. In India, it's completely different. Klebsiella, most common, followed by Acinetobacter and then followed by Staph aureus. Symptoms, what you see is weak immune response, that is non-specific symptoms. Then suspect sepsis in any sick baby. Recognize as symptoms is that early symptoms, you will see change in feeding pattern, you will see lethargy, you will see hypothermia, more common than fever, and you will see pneumonia or respiratory distress. Signs specific to organ system like meningitis, you will see fever and irritability, which is non-specific, and you will see seizures. Investigation, blood culture is the gold standard. Disadvantage, it is time consuming. Sepsis screen is presence of more than 2 findings. It is called the sepsis screen. So what is your sepsis screen? Components and the values. So WBC is less than 5000. Out of that, neutrophil is even less than 1800. And then immature to total neutrophil ratio is more than 0.2, which is increased. Micro ESR is more than 15, and CRP is more than 1 milligram per deciliter. So all values are increasing while your leukocytes and neutrophils are decreasing. Newest marker of neonatal screening is increased procalcitonin. So newest marker of neonatal screening is increased procalcitonin. Gold standard is culture, but it is time consuming. Lumbar puncture indication, when there is a suspicion of meningitis in all symptomatic babies, then you do lumbar puncture. Contraindication is asymptomatic babies even with risk factors. If there are no symptoms, then don't do lumbar puncture. Treatment. Empirical antibiotics while awaiting culture reports. Clinical scenario. So first we'll see suspected meningitis. Then you give ampicillin plus third generation cephalosporin like cefotaxime. If it is low resistant infection, then you give penicillin gram to cover the grams and aminoglycosides like amikacin or gentamicin. If it is a high resistant, then you give ciprofloxacin plus amikacin or piperacillin tazobactam, or amikacin for high resistance. Duration of treatment. If culture is negative, then 1 week is enough. If culture is positive and you see meningitis, then 3 weeks. And if it is other things, then 2 weeks. So meningitis is 3 weeks. Let's see the sepsis algorithm. Suspected sepsis. Is it early onset or late onset? Early onset, that is within 3 days, and there are no risk factors, then you do just close monitorings. If the risk factors are present, so what are the risk factors that we do? Then we start antibiotics and we do blood cultures. And if there are symptoms of meningitis, then we do lumbar puncture. Um, if there are no symptoms, then we don't do lumbar puncture. But it is late onset, coming from the mother after 3 days, and you see no symptoms, still close monitoring, nothing to do. But if you see symptoms, that is your baby is sick, then you do antibiotics, blood culture, and lumbar puncture. If the baby is not sick, then sepsis screen. If sepsis screen is positive, then you do antibiotics, blood culture, and lumbar puncture. So we are trying to avoid the treatment. Okay, we will start with respiratory distress syndrome in the next video.